मैडम जी बताइए।
उसके पापा नहीं मान रहे।
ठीक है, नहीं जो आप लोग डिसाइड करें ना।
नहीं, लेकिन मैं क्या पूछ रही थी कि समझो अभी अभी हमने सिर्फ नाक का ही किया,
हाँ,
तो वो कितना परसेंट उसके फेस में
इम्प्रूवमेंट बहुत होगा।
कितना परसेंट होगा लेकिन इम्प्रूवमेंट?
परसेंट कैसे बताएं मैडम, काफ़ी इम्प्रूवमेंट होगा, ऐसे नहीं कि इम्प्रूवमेंट नहीं होगा, काफ़ी इम्प्रूवमेंट होगा इनके केस में।
मैं तो चाह रही हूँ, लेकिन मैं अभी उनको, और अभी क्या है ना, ही इज ऑल्सो इन अ मीटिंग, तो वो भी एकदम ये है, बोले कि मैं ज़्यादा नहीं बात कर सकता, मैंने तुमको इसके लिए भेजा था, वो भी मैंने कैसे भेजा। एक्चुअली आई एम कन्विंस कि आई नो, क्योंकि मैंने आप जो बता रहे थे ना, तो हम दोनों वो बात हो चुकी थी हमारी। वी नो दैट उसका चिन एरिया बहुत छोटा है, और थोड़ा ये, क्योंकि मैंने जो आपको फोटोज भेजे थे ना, उसमें वो क्लियरली विजिबल है।
अभी भी जब स्पेशली जब ये बात करती है और स्माइल करती है तो बहुत विजिबल है।
तो उसके
लेकिन देखो अभी आपके फादर मान नहीं रहे, तो जो मतलब आप एक मतलब कंसल्टेशन हो गया है, इम्पॉर्टेंट है ये बहुत। ऐसा मत सोचो कि इतना दूर आ गए और सिर्फ कंसल्टेशन हुआ है, क्योंकि कंसल्टेशन, आपका स्कैन जो मैंने देखा है, ये सब बहुत इंपॉर्टेंट स्टेप है। इसमें भी देखो आपका मैंडिबल से बहुत फ्लैट है, तो ये इम्प्रूवमेंट के लिए रेडी है, करेक्ट है। स्कैन में भी वही दिख रहा है। अगर आप चाहते हैं तो मैं राइनोप्लास्टी कर सकता हूँ, अभी नहीं चाहते हैं तो आप कुछ भी मत कराओ, वापस जाके भी आ सकते हैं, जो आपकी नहीं
दूर जाके इतने अभी मैं आई हूँ और कुछ नहीं करूँगी तो
फिर ऐसे आपका ओरिजिनल प्लान था वैसे ही करेंगे। मेरा रिस्पॉन्सिबिलिटी था, मैं जो बेटर था आपको बताऊं।
आई टोटली
बट अगर फादर इज नॉट अग्रीइंग तो फिर क्या कर सकते हैं अभी। मतलब आपको टाइम है रात तक भी, कल सवेरे भी आप बता सकते हैं हमें। हाँ, अगर वो बिजी है तो रात तक बात कीजिए, कल भी बताओ मुझे, कोई दिक्कत नहीं होता, आधा घंटा आधा दिन में। और कल सवेरे नहीं हो पाएगा तो कल दोपहर को प्लान कर सकते हैं।
अच्छा, अगर समझो राइनोप्लास्टी करते हैं अभी, तो व्हाट विल बी द शेप ऑफ द नोज?
विल मेक इट नाइस एंड प्रोजेक्टेड, जैसा आपका आपसे प्रोजेक्टेड ज़्यादा होगा। हाँ, आप दिखा सकते हैं, मैं बताता हूँ कितना होगा। आपका नोज से थोड़ा ज़्यादा प्रोजेक्शन होगा,
थोड़ा ज़्यादा।
हाँ, एकदम शार्प
नहीं, वो तो
एकदम बहुत बड़ा नहीं होगा।
नहीं, हम वो चाहते भी नहीं।
हाँ,
क्योंकि ऐसे नेचुरल फ्लो में हम चाहते हैं,
वही रहेगा, नेचुरल में लगा, नेचुरल आएगा। Maybe a little less than this, but yeah. Sure.
See, can you see my see?
Yeah. So.
I have a little bump also here.
हाँ.
And she is getting also, मुझे कोई प्रॉब्लम नहीं है, उसको भी कोई प्रॉब्लम नहीं है। बट मेरा जो एक्चुअली मेरा फ्रंट से थोड़ा फ्लैट ही है।
हाँ.
मेरा, लेकिन मेरा वैसे ना ही होके आगे सामने से भी थोड़ा सा आएगा। और जैसे मैं साइड फेस से मेरा जैसे दिखता है वैसे जैसे वहाँ, वैसे अगर उसका होगा तो
हो जाएगा पक्का, इससे ज़्यादा ही होगा।
हाँ, इससे ज़्यादा, मतलब मेरा तो बहुत कम है, इससे ज़्यादा और थोड़ा होगा तो बहुत अच्छा होगा।
पक्का हो जाएगा,
अच्छा हो जाएगा, और उसको अच्छा दिखेगा वो।
पक्का अच्छा दिखेगा, उसमें डाउट क्या है? अच्छा ही दिखेगा।
अच्छा ही दिखेगा। Like when I smile, it won't like
it won't look anything. When you smile, your nose is not going to change.
अच्छा.
Nose is going to look nice, right? A very sharp projected nose always looks good. So see, couple of things that like see, your face is pretty much round, almost, and plus the nose is not that protrusive, and if you see the eye inside are also not very sharp for you. When I do the nose, that will get sharper. See your eyes for your mom, sharp जा रहा है ना अंदर. Yours, that is also a little bit rounded. So when we pull here, when we give it bone, that will also get little better. Okay. So your eyes also will look a little bit more elongated. Yeah, that looks nicer because the proportion of the eyes is important. So when you stretch the medial canthus, I can show you now itself. If you just do that, see, thoda ho raha already. So it will become like that because we're going to pull it up here. So that will be just a slight improvement. Other than that, this is very broad for her.
हाँ
So this I'll be fracturing it.
हाँ
So then it will come near, and then for the height we'll put rib also.
ओके
So therefore, it should be better.
कैसे दिखेगा? आप किसी का किया हुआ दिखता
हाँ,
है
आपको दिखा सकते हैं या ना, और वीडियो कुछ भी आप देख सकते हो. मॉर्फिंग भी कर सकते हैं, बट मॉर्फिंग में आपको कोई बेनिफिट, फोटोशॉप में उसमें आपको कोई बेनिफिट नहीं है. ऐसी मतलब some app also can do that. So it's not like a very big deal that I go and do that. You can imagine, na? See, in your case, it's very easy for me to tell because it's going to be slightly better than your mom's. In terms of the projection, it will be narrower than this. It's little bit more projection.
And mine is here, mine is flat.
That will be made projected for her. So this depression, which is too much, will not be that much. Yeah. But her forehead shape and your forehead shape are slightly different. She has extra curvature there. We'll be doing some work there, and it will not look so depressed now after surgery.
After surgery.
Yeah. That's called radix. The place where the nose starts.
उसका यहाँ पर थोड़ा सा ऐसे कर्व आ गया है.
हाँ.
और ये एकदम फ्लैट हो गया है.
हाँ, तो रिलेटिव है.
हाँ, तो इसकी वजह से वो और भी ज़्यादा
करेक्ट.
हाँ, इसलिए वो और भी ज़्यादा वो फ्लैटनेस हाईलाइट हो जाता है.
हाईलाइट हो रहा है, एग्जैक्टली. और चिन भी छोटा है. तो अगेन इट मेक्स इट लाइक दैट. अगर चिन को थोड़ा शार्प, ये थोड़ा नैरो, प्रोपोर्शन को थोड़ा
बढ़ाए. अभी if I do this surgery, then
you can still do, but lower jaw we can do anytime, no connection. Upper jaw, see when she smiles, you can see the teeth are a little bit big, and you can see the gums. That she look very cute. Sorry?
Do you have a daughter?
No, I have 2 sons, unfortunately. Why? You think you are unfortunate having a daughter?
No.
Okay.
Never.
Having a daughter is a good thing to do, but then it's not in your hands.
I'm very much blessed.
Yeah.
I have a
Daughter.
daughter. मैंने इसलिए आपको पूछा, आपको इतनी सारी लड़कियां आप देखते हैं और सबका ठीक करते हैं इसीलिए कि आपकी लड़की कैसी होगी.
अरे मेरी लड़की होती तो सुंदर होती, बट मेरी वाइफ इज ऑल्सो.
उसके ऊपर भी किया है? नहीं किया. अरे
नहीं किया. मेरी वाइफ को करना है वैसे, वो मेरे पीछे पड़ी हुई है काफ़ी सालों से अभी, तो मैं नहीं कर रहा बिकॉज शी हैड एन एक्सीडेंट एंड लाइक सम CSF, राइनोरिया एंड ऑल दैट. तो इसके वजह से इफ़ यू डू दैट अगेन, so sometimes you can get this leak from the brain fluid. It's a risky thing. इसके वजह से नहीं कर रहा हूँ. आज तो सबको कराना है, ये तो बहुत कॉमन प्रोसीजर. या
पूरा आपके हाथ में दे दिया है.
डोंट वरी.
I'm not going to worry.
Don't worry about all of that.
आपको
आपका मेन है डिसीजन.
मैंने उसको कभी भी एक दिन के लिए भी कहीं पर भी नहीं छोड़ा है.
अभी भी मत छोड़ो.
अभी भी मैं नहीं छोड़ा.
बस सर्जरी के लिए 2-3 घंटा लगेगा, आप तब तक बस वेट कीजिए. एक दिन नहीं छोड़ना.
आपको पूछने वाली थी कि मैं सर्जरी के वहाँ पर आऊँ क्या, लेकिन
फेंट हो जाऊंगी आप. मैं देखेंगी तो मैं क्या क्या करूँगा. ऐसा नहीं लोड है. सर्जरी की इमीडिएट बाद जब ये ICU में शिफ्ट करेंगे, आप विल लेट यू सी हर.
ओके.
Done? No more doubts. So in case we'll plan for the nose as it stands. I'll be taking rib. Scar won't be visible. Not much pain also, but maybe little pain for a day or 2 for you because I'll take. No, not the floating rib. If I take the floating rib, it will be down. This is the floating rib. There'll be a scar. So I'll make an incision just under the breast. So the scar won't be visible. Floating rib can't be taken with that.
But the scar won't be there.
No scar will be there. That's the most important thing. Get an extra scar later on, 2 years, 5 years, 20 years later. I don't know, you don't like the scar. It's very difficult to get rid of it. It'll be a faint line. But in this area, there's no scar anyways. There's a crease. There's an inframammary crease. So the incision is made in the crease. So it's the best way to do. This is easier to take, but what you're saying, the free rib is easier to take. So a lot of surgeons do take that. It's easier.
Because we have seen some surgeons doing that, no? Yes, taking the floating.
It's the easier thing to do, but it leaves a scar behind. For men, you can take it, because for men, for anyway, there's going to be a scar. But for women, it's not a good idea.
Okay.
And also the floating rib many times is not there for all patients, and some patients it can be very small and slender. I'll have to palpate and see,
Okay.
because when you do a lot of augmentation you need some good volume. छोटा सा निकाल के उसको नहीं लगाना, उसको शेप भी करना पड़ता है ना, तो अगर मैं बड़ा पीस नहीं मिला
And
तो
that will वो सब उसमें अपने आप ये हो
सेट
जाएगा।
अपने आप बैठ जाएगा उस
अपने
पे।
आप बैठ जाएगा और उसमें ये भी हो जाएगा ना, उसमें मर्ज भी हो जाएगा ना।
Yeah, it will be part of her body only.
Okay.
That's the best thing about doing it like this. So it's there for life.
Yes.
Done. So I'll see you tomorrow.
Tomorrow.
In case
the
you do
morning.
change morning.
Okay. At what time?
You come here by about 8:30.
8:30. I'm going to admit today, na? Or
No, tomorrow only.
Tomorrow only. Okay.
So nothing to do today. Have nice dinner.
Okay.
Morning you can come. Maybe at 6 o'clock you can have some drink, coffee or tea or juice or something very mild, and then come over by 8:30.
One glass of
One glass. Then we can work her up. We'll get the room and shifter and everything. And by the time you can let me know. We're planning for the nose now, but just in case.
Just in case.
Let me know if
let
suppose
you know.
anything is there. Otherwise we'll proceed the same thing.
Okay.
All right.
Okay. Thank you.
Pleasure. I'll see you tomorrow.
Hello everyone, I'm here with this young girl who has come from the west of the country. She's all smiles, excited for the surgery, not nervous. No, okay, glad that she's so happy. Okay, so she's come for rhinoplasty. Rhinoplasty because her nose is quite flat. It's flat, it's flared. If she turns to one side, we can clearly see there is minimal height, almost no height, right from the radix till the tip, right? When she smiles, obviously she has a beautiful smile, but there's little bit of gumminess. If you smile full-fledged, then we can see. Yes, Dr. Richardson did tell her about having a vertical maxillary excess with respect to the jaw as well, but she said that's something that she'll do it later, not at the moment. So at the moment, her concern remains the nose and also the flared base over here. So it will be a rhinoplasty also with a huge possibility of rib harvest, almost possibility, almost a certainty. That's because it's a flat nose, very less dorsal height. She doesn't have much specifications about a very aesthetically appealing nose, but a nose which is better than this, a nose which has certain amount of dorsal height which gives her the desired projection. So we'll start with the rhinoplasty in open structure, augmentative rhinoplasty by Dr. Richardson. We'll also go on to see how she goes home after the splint is removed and how the surgery happens. Yes, right? Hungry? Not quite? No. Not yet. Okay. And also we'll be giving you fluids during the surgery. After the surgery again there will be some time where you have to be a little empty stomach. Post that you'll be fine. Remember there will be pack inside the nose. So mouth breathing post surgery. Splint will be there, that is removed after 7 days. I keep telling this to patients, but I know they are used to seeing this in the YouTube videos as well. Okay, so we'll start with this now. Yeah, thank you.
Reconstructive kind of cosmetic nose job. I'm using all those terms because we had to do a lot of work, not only in the nasal bone, the radix, but a little bit at the forehead as well. I'm going to show you the different views. Okay, now we're going to show you how the nose was before we started. You can see that it was very, very flat. And now we've augmented it severely, more than a centimeter. We're going to show you the side view. You can appreciate this. Okay. And eventually and you can see the improvement. Sorry for those bindi marks. Okay, we're going to show you the picture. And you can see the difference. You see, we've done major work around this area. She had a totally almost missing nasal bones. No history of accident, no history of anything, just a primary case. And you can see the canthal fold as well, the medial canthus. So we've gotten a lot of augmentation here. Obviously the tip worked too. The septum wasn't supporting enough. I'm going to show you the side view, where again you can appreciate the improvement. It was like in flush with the forehead, and now it's about a centimeter high there. There's still some edema, mind you, so it's going to come down here a little bit, but still it's a severe augmentation from where we started off from. And then the basal view. So here you can see the overall improvement.
Everyone, here we are with a patient 10 days post surgery. Yes, she stayed quite long with us, and that's because she's come all the way from the west of the country. It's already loose. Her complaints were that of a flat nose, so she wanted rhinoplasty for dorsal augmentation. Am I excited? Yeah. She's patiently waited with us for almost 10 days. That's because a lot of augmentative work was done. Hope it's as good as you expect, if not better. There's some bruising, so I'll clean up everything first. The splint was here for too long, so the skin has abraded a little bit. All those are just the skin patches. Yeah, she's only looking for her mom's reaction. Yes, her mom has been here with her for too long. Now we'll get the pre-operative pictures for her. You can take the mirror and have a look yourself.
Yes.
Turn side. So she had an extremely flat nose. There was almost no dorsum. She wanted dorsal augmentation. That was the main requirement. She already had a face which was proportional, and she wanted a nose which suits the face a little bit. We'll see from the side view. Turn one side, one mind. We'll show that profile view. Keep it here. Yes. You can have a look yourself in the mirror. Turn towards your left. See, this is towards your left. This is showing your right profile, right? Yeah. So if you turn your head, tilt your head that way, you can compare both the profiles. Yes, right. Huh? Even your mother can come and see. Come, ma'am. Yeah. So there was almost no height at the radix. Yes, her nose had a curve, a gentle curve, but the curve has been accentuated right now. The work has been done right from the radix. There is swelling which is existing at the radix, but it's coming right from the radix, the dorsum till the tip. Everything is become augmented, it's become straighter, it's become narrower as well. Earlier it was flared, it was broad here. Work has also been done at the base. If we can see the basal view, please. Yes, you can also have a look at this. This base, the alar base, has also been worked upon. It's been made proportional to the nose, the dorsum, the radix. Osteotomy has been done. That's the reason we will see the stitches over here. That will be gone. Swelling does exist on these portions. It will resolve. It will take time. Rib had to be taken because it was done with augmentation along with the rib graft. Right? All these will be cleaned now. I know you were waiting for all this while. You did have swelling around your eyes that have gone down now. I told you by the time you will go, you will be back to normal. But yes, your nose might not feel 100% normal. That takes time, right? How was your stay? You were with us. Your mom has been here throughout.
Yes. I couldn't have done this without her.
Yes.
Yeah, and it was a nice experience overall.
Yeah. You're happy with what you're seeing right now?
Yes.
Yeah.
But the swelling is still there, na? It
Swelling
will
is
reduce
there.
up to
Initial healing, ma'am, initial swelling 4 weeks minimum. But for her, even in spite of this healing, it's good. In spite of the swelling, it's good.
It's good.
Yeah. For her, you remember the swelling was huge around the eyes. It's come down remarkably. Remarkably. Still swelling is existing.
40% swelling is there.
Yes, definitely.
It will go down, this swelling.
Yes, it will go down. It will go down, ma'am. Yes, there's swelling here, swelling. No touching the nose repeatedly. The sutures will all be taken out. Some cleaning will be done because the splint was here for so long. So the skin is compressed beneath it. That will be corrected. Her rib stitches will be taken off today. She's healed quite well. Swelling is existing, but it will come down. Keep in touch with us. Yes, completely will come down. Is there any pain right now?
No.
How is your healing? You're feeling better?
Yeah, I feel like I healed very, like the first 5 days, they were like pretty difficult.
Tough. Also because the pack was there, breathing was difficult.
Breathing this was the hardest part. So when they removed the bandage
Pack.
inside, so from then I started healing.
Recovering better?
Yes.
Yes. It's also got to do because people feel they're choking up because of the pack. The pack is a problem for a lot of patients, but that acts as an internal splint as well. And after that is removed, because you can breathe freely, it's better. The people are like, okay, we are back to life.
Yeah, because not everyone is used to mouth
True.
breathing.
True. Mouth breathing is a problem in those days. True. I completely understand. But you look good. I'm very happy that you've recovered. Would be happier if you can keep in touch with us.
Yes, definitely.
And give in your feedback. Take in medications on time. Remember all the instructions given.
See,
Yes?
Here also there is swelling. No?
Yes.
Still there is
Yes,
a
swelling is there,
So
ma'am.
it will, when the swelling will go completely, then it will look more prominent. No.
It will look more natural also.
Natural
Right
also.
now, yes, right now even if I'm touching, it's stiff.
it's swollen and stiff. Everything will come down, ma'am. Remember the swelling around the eyes, now it's blue and black. So things will take time to settle, but it will come down. It will become more natural. Right now even it's looking natural. In spite of the splint being there, it's looking natural. I'm only... That's because the splint was there, ma'am. The splint has compressed the skin for so long. I'll clean it up, it will go.
Acha, okay.
Okay? Yes? Okay. Thank you.